So the beauty of NIMS is one of the things that's great about it is its span of control. So span of control is basically how many subordinates do you have? You can have anywhere between 3 and 7 subordinates, with most people saying the sweet spot is about 5. The incident commander is going to have multiple subordinates under that person. Incident commander, of course, is in charge of all of the operations on the incident, everything from finance to public relations to operations to logistics. And those are actually 4 different positions that you'll see in a structure for an ICS, or incident command system. Um, so you'll see logistics, you'll see PR guy, you'll see somebody out there handling operations, you'll see somebody out there handling those other things, finance, for instance. But under operations is what we're going to be working under. You'll have the operations section chief. Okay, and he's underneath that section chief. You'll have anywhere between 3 to 5, again, sometimes up to 7 people under that individual. And the most common ones we see with the medical or ESF 8 section of ICS is the triage unit, the treatment unit, and the transport unit, or officer rather. And triage, of course, the officer there is responsible for triaging patients, setting up a triage area, and then going from there. The treatment unit, of course, their responsibility is to treat the patients and while they're being prepared for transport. And then the transport unit, its job is to take those patients off of the MCI scene and get them to the hospital as rapidly as possible. And not just get them to the hospital, but get them to the right hospital. When I say the right hospital, I don't just mean capability-wise. I mean, they need to be routed, right? So we can't send 30 people to university. It's going to overwhelm them. We need to send just the critical patients over there. We need to reserve our level 1 trauma center for our high acuity red type triage patients, and our lower acuity patients we can send like maybe 5 over to Tulane, and then maybe 5 over to Arturo, and then maybe 5 over to Oshner, Maine, or something like that. And they need to be split up. We can't just send everybody. So not just transporting them to a hospital with capabilities, but a hospital that's not already overloaded with lots and lots of patients.